Well, hello everyone. Welcome to one of the last sessions of the first day. So it's very exciting to see everyone here. This is actually the first time we'll be doing this. I'm joined by one of my partners, Dr. Tan. I'm Laura Shin. We both work at USC. We are the flow and the toe and flow of USC. This is it's actually pretty humbling to be up here with this group today. As much as we revere all of our education and stuff, the end is, what we do and for these patients here. So I would like to introduce 3 patients that have been touched by the vascular department here at USC. We're honored to have them here today, and they've all agreed to kind of come in and share their stories. So for any students, for any clinicians, this is really why we do what we do. This is really why we keep pushing the envelope and try, to continue to do better. So I have at the end over there, Miss Alice Rivera, Mr. Alex Colton, and Mr. George Woods. So we're going to let everyone kind of talk.
So my story started a long time ago. I've had type 1 diabetes almost 50 years. I met Dr. Armstrong originally at University of Arizona, which is where I'm from. I'm from Scottsdale, Arizona. And when he was stolen here by Keck, they stole him from Arizona. I followed him. I said, I don't care where you go, but I'm following you wherever you go. And then he had taken 5 of my toes. I have 2 toes on my left foot, and I have 3 toes on my right foot. But I have shoes on and walk with a walker right now because after these toe amputations, and a lot of things happen to a type 1 diabetic, I'm going to be 70 in February, so I'm still here. And he introduced me to the lovely Dr. Shin, who I ended up having a tibia and a fibula break in my leg, and she put me into an external fixator twice. Was in it for 27 weeks in 2020, so I was in a wheelchair for quite a long time, but Dr. Armstrong and Dr. Shin, I feel like they're family. They're just unbelievable. I love them to death. They're the best team that a patient could have, and that's why I'm here today to explain that to everybody. And in Arizona, it was the Salsa Clinic, and now here at Keck, it's the Salsa Clinic, headed up by Dr. Shin and Dr. Armstrong and Dr. Rowe. And Dr. Rowe performed many surgeries on me. And, when I went to the first hospital and showed them my injury, they told me they amputated the knee. So me and my wife, who's out there, without her support, there's no way. She's amazing. Dr. Shin and Dr. Armstrong know that. But we keep driving to California here to see them, and they keep helping me, and I walk right now with a walker. I'd like to walk without a walker one day, but it may or may not happen. But I don't give up. Even Dr. Armstrong posted something about me when I had the external fixator. I was using a recumbent bike with a mop, pushing the pedals with a mop because I couldn't use that leg. But I don't stop exercising. I exercise every day. But I hope I shared my story in a brief way. So thank you all for listening to me.
Testing. My name is George Woods, and I am very honored to be here today. I am a double amputee. I lost my right leg with a below-knee amputation on my birthday 2 years ago, May 23rd. Dr. Armstrong was going to save half of my right foot, but due to situations, because I got a second opinion and didn't want to lose my leg, I went over to I was in Kaiser, and I ended up at Keck with Dr. Armstrong and Dr. Rowe. And the plan was to save the back of my heel, and I just lose the front part of my right foot. I had peripheral vascular disease, and my right foot became black and hard like a brick. Because I didn't get released from Kaiser in time, Dr. Armstrong was never able to work his miracle. But I have to share in consultation with Dr. Armstrong, I felt so in safe hands and had so much trust in him just by his gentleness, his kindness, and proving to me that he knew what he was doing. So because I wasn't able to get released from Kaiser, I ended up getting my right leg amputated by Dr. Vincent Rowe. That was on my birthday. I showed Dr. Armstrong my left foot when I was getting ready to go to surgery, and he said, "Oh no, you got gangrene in your left toe." I ended up losing 4 toes in the beginning on my left foot. They left a hole in the bottom of my foot where they couldn't close it, and to make a long story short, because of the gangrene that developed in my left foot, I ended up getting my left leg amputated September 10th, 2 years ago. Today, I am able to drive. I drive with my hands. I am able to cook, take care of myself. My goal is to get back on the 50 and over league basketball team, which is starting this month. And I know I can't run, but I can jog up the court, and I just want to be out there back with the fellas. And when I had this opportunity to come here and share my story, I had 8 operations. They took veins out of my legs to try to put in my lower leg to save my legs. Peripheral vascular disease meant I had no blood going to my feet. And this was a challenge because I was a very active person, but I believed in the doctors at Keck. I believed in myself. I believed in blind faith and the attitude that I can and I won't give up. People were, "Oh, I'm sorry what happened." Please don't come at me with sorry. I have faith and I believe in myself and I believe in my doctors. And today, I'm here saying, please don't be sorry for me. I have faith in my doctors, I have faith in myself, and today I can stand, walk, and be proud. And Miss Alice and Mr. Alex, I am so honored to be here with you two and to share with you that if I could come from no legs and do it, you could do it too. And to anyone that's going through this, it's mind over matter, and you have to love yourself and say, I can do my part if I follow my diet, if I do what my doctors tell me to do, because I've been diabetic over 16 years. I'm a dietetic technician. I worked in probation. I did a lot of walking. I did a lot of everything, but what I didn't do was take care of my diabetes. And because I didn't take care of it, this is the end result. But it's not the end, because I have the ability and the courage to tell anyone, anything in this situation, I have no problem talking to anyone about it. But the biggest thing is you have to follow your diet. If blood is not flowing, it's just like a rose bush not getting water. It's going to die. But that does not mean that you're dead. That does not mean that you can't still contribute. So I want to stay positive and thank Keck once again for the opportunity to be here. And I also want to thank my daughter, Dr. Dominique Woods, who was being trained in surgery. So when I went through all this, my daughter was able to communicate with Dr. Shin, Dr. Rowe, Dr. Armstrong, and now we're all one big family. I'm part of Rancho Research. I love Mike, I love Chuck, and I'm in this family, so whatever you guys need from me, I'm here. I just want to give back. Thank you.
Yeah.
Thank you so much for sharing all your stories. I think we are very grateful that you guys are all here. I think you mentioned a little bit about family support, including from your daughter and you and your son and your family. Can you talk a little bit more about the support that you need to go through this long journey?
My main support is my wife who's sitting out there. Without her, I wouldn't be here. She totally takes care of me. Dr. Shin and Dr. Armstrong know that. I do have 3 adult children, but they all live in California and I'm in Arizona. And they got their lives and their my daughter's got a little one. So it's mainly my wife. She's my caretaker. We do dialysis at home. She does all my treatments. They trained her. She's just amazing. Without her, couldn't be here. And you're lucky that you have a big family that helps you. Alice next to me. I'm just lucky that I have my wife. And I can't really elaborate too much more. She just does everything from soup to nuts for me, That's the best way for me to explain it.
And thank you. And how about you, Mr. Wood?
Yes, I have very strong family support. If it wasn't for my wife, my daughter, I have a lot of nieces and nephews, sisters and brothers. I've had a lot of support. And I just learned something from Miss Alice that I'm not going to say anymore. Somebody tried to help me up the stairs, and I said, I got it. I have this thing about me, let me do it. And that's a good thing, but just like she said, if somebody's offering to help you, you still should be nice and say, okay, thank you. Like the gentleman tried to help me, and I caught myself, and he tried to help me, and I said, thank you, and we did it together. So I'm learning that I didn't make it this far by myself, and I can't make it any farther if I don't be honest and say, in my situation, when I get ready to get dressed or to go somewhere, I'll say, well, I'll be there in 10 minutes. I know it's going to take me 30 minutes to get ready, so I need to stop saying 10 minutes and then get frustrated when I know in my condition it's going to take me 20 minutes. But I have learned that if no one helped me, I would not be in the shape I am today. So I do appreciate the help that family, friends, the church, religion, all that plays a part in this. You got to have a full tree to pull from because you feel like a limb that has fell off the tree. And once you realize that I can be part of this tree if I don't be hard on me and accept help from people. But my thing was always, if I depend on somebody, what's going to happen when nobody's there? So I always had the thing, well, let me do it for myself. Let me do it for myself. But I'm going to take what you said, because people ask me all the time, can I help you? And I say, I got it. No, I'm going to let them do what their heart told them to do for me, and then tell them I appreciate it. So thank you for correcting me. And I have a wife like yours that got my back, Alex, so we're all on the same page.
My husband also he was great too, and he's a little bit older than myself, and he's just went to battle with cancer, but he's there all the time, thinking about me.
So we're all in good hands.
Yeah.
No,
Thank God.
Thank you so much for sharing.
Yes.
What are some of the suggestions that you give other patients if they don't have a good family support? I think we're all lucky that we have
That's That's a hard one.
Yeah, it's a hard one.
I worked in geriatrics for many years in skilled nursing, so I dealt with a lot of the elderly that didn't have family. And it's hard to try to heal, and there's no one that you actually love there to encourage. That's why it's good that you have your doctors, your nurses, your team, because you become a patient's family and support system. I mean, even though Dr. Armstrong didn't operate on me, that's my doctor.
Yeah.
And I can tell anybody that meets Dr. Armstrong, he's the same from the day I met him to me seeing him 2 years later today. It's his heart. So if anybody got a heart for you, you got to have a heart for somebody. And by me working in geriatrics and skilled nursing and running the food service department and making sure the patient's diet was right and families were happy with food service, I never knew that one day that might come back to me. And sure enough in life, it came back to me. So I'm glad I did the right thing. But for a patient with no family,
That's right.
you have to lean on your medical family. I'm being very honest because a lot of people don't want to talk about medically, I lost my legs. Some people be like, oh my God, he's weirder or something. So you have to be careful, but yet be open, but understanding. Because I had to develop a tiger-like reptile skin because it can be emotional, and a lot of people don't understand it. And people can say things that are hurtful, not meaning it, but not knowing your situation. Like when I explained to people what it took for me to take a shower, what it takes for me to get dressed, what it takes for me to walk in church, what it takes for me to have my legs on all day. I remember when I couldn't wear my legs all day. Now I'm running in my legs. So it starts with self-will, faith, love, family, and your medical team family. And those that'll love you, because some people genuinely have a heart when they see you're impaired. So it's an iffy thing, but it's hard without family. And I know I couldn't have made it without my family. So I can't say what it would be like without family, but I can go from my experience dealing with people that I saw amputee in skilled nursing with no family. And when you reach out, they gravitate to you because they see that you care and you have a loving heart. And that's all I can share, because that's what I dealt with.
I think this is another reminder for us to be an advocate for our patients. You know, it's sort of pervasive. You know, sometimes they're just like, it's easier, just get the amputation. You know, just keep cutting. It's easier than going through these interventions. It's easier. So a lot of times it's, you know, that journey is with you. It's not, you know, to you. It's actually, you know, with you. And I think that's an important thing that we need to take. You know, and that's the most important part, you know, of all of this meeting. The purpose is that we're going through that journey. We're trying to make ourselves better. We're trying to advance technology so that we can make it better for our patients overall. And I think Dr. Armstrong wants to actually show this video. I'm seeing him frantically. Could we pull that up, please?
Oh, God.
What's that?
That's me.
Oh, that's you?
I'd like to
Yay!
This is after I explicitly told him not to put any weight on this.
You're a movie star.
You know, I think the other thing is that you guys have downplayed this journey of how difficult it was, the level of infection, the fact that, you know, in most cases, and I would say, you know, if you were anywhere else in the country, most people would have said, let's just go straight to amputation. We would have they wouldn't have tried. There would be no attempts that were made. Do you feel that way? Or, you know, I mean, Alex, you keep coming back to California, and what are your thoughts?
I'm sorry, what was the question again?
Just that, you know, that other parts of the country may not have attempted some of the limb salvage efforts.
Well, I know with my Charcot, I went to my podiatrist, and they didn't know what it was. And Dr. Armstrong, when he first saw me, he said, oh, yeah, any other podiatrist would have chopped your foot off. He said, I got there just in time, and it was, like I said, they put me at the right place at the right time, or they put you at the right place at the right time. I was really, I could have lost my foot. But, geez, like I said, it was a miracle for me. And it's still a miracle because, like I said, you guys are still doing your job, and I'm still hanging in there. Thank you so much for everything. I appreciate everything.
Well, for me and my wife started out in Sherman Oaks looking for a doctor from a patient that was going there. It was the mother of a co-worker of my wife's. We went to Sherman Oaks to see Dr. Rogers, Lee Rogers. I'm sure you know who that is, or Dr. Armstrong
He might be here
does.
somewhere.
He's familiar with him. And he said that when he looked at my foot and everything, that was when I needed my big toe amputated, my left foot. He sent me to University of Arizona to, I think, a partner of Dr. Armstrong's, but he was leaving to go to Texas at the time. So then I saw Dr. Armstrong and Dr. Goshima. Dr. Goshima is like Dr. Rowe, a vascular surgeon, and she tried doing something that nobody else said they could do with water, no dye, with no dye. To take a look, and of course I taught her out of a few things, and then eventually I had to have the big toe amputated. But it's perseverance that you have to have within your body. Just like you saw the video of me, I will exercise because exercise helps control the blood sugar. I'm proud to say that my A1C is in the low fives because of what I've done for a long, long time. Even though I have complications from diabetes, it's just part of the disease, but I just keep moving on. And again, without my wife, I couldn't do it. So patients have to have that inner strength like was talking about. You just have to have it. You gotta just keep going, and I'll
We
keep
have no
driving. And I'll
choice.
keep driving to California as much as we can. It's a nice 6.5, 7-hour drive, but we do it. That's what you wanted to hear.
How about you mentioned, just even hospital systems within the same geographical area, people have very different approaches, and I think that's important to at least give patients that power to have some options or at least try. It may not, the end result may be, inevitable, but at the same time, if you feel that, hey, we did our best, this is the outcome, I think it's sometimes easier to accept as well.
Obviously, we are all really lucky to have Dr. Armstrong and Dr. Shin in our team. But not everyone in this country has access. So what are some of the advice that you give to a new patient that with a new ulcer that is going through this process early, and what can they do to help themselves? Alex, how about you? Yes.
Well, I guess the main thing is you have to keep on top of it. If you're especially if you're diabetic, you have to just be your own doctor. You have to check your feed and make sure that, you don't see any problems with it. And if you do, you have to just kind of push the doctor to tell him, well, I think I have this or I think I have that. Like I said, I didn't know anything about I never had any foot problems at all. So mine started off just my foot got swollen, and they thought I had, I can't think of the word. When you have gout. Oh yeah, they thought I had gout. So I went like almost 3 weeks. My foot was swollen, and they gave me medication for gout, and it was like, whoa, how scary. So one of my bones started protruding, and they said, well, no, this doesn't seem like gout. That's what happened. So my doctor did speak to someone else, and that's when they advised me to go to Dr. Armstrong. But I don't know how other places, what they do. How would you know if it's a good doctor? Check the web, I guess, website, or I don't know, I'm not too computer savvy, but I was just lucky that my doctor sent me to a specialist and happened to be Dr. Armstrong. But basically, you have to be your own doctor. You're not a doctor, but you have to look at your feet and see, if you see a little redness or something, especially if you're diabetic, then go to the doctor and start early. If you start too late after you have a big ulcer, and then probably it'll be too late. But that's basically all I can say. I was just lucky to be directed to the right place when I had my problems.
So it sounds like we have to advocate for ourselves, right?
Yeah,
Like keep
right.
on top.
You know what, you just have to do what you can, and sometimes if you don't have family members, reach out to friends. People have friends. Reach out to work colleagues, work accountants, reach out to your clients. You just got to keep reaching out until you find the answer, and you can't give up. I commend the gentleman next to me. He didn't give up. He's here today. He's going to play basketball again with his buddies. I wish I could play basketball again, but my playing basketball days have been over for a while, but it's okay. I played enough, You just have to keep pushing. That's why I'm still here, 49 years later, type 1 diabetes. It's pretty serious, and a dialysis patient now. So, but I feel good, and everything my wife does for me has helped me feel good.
This is going to go down in history for my favorite session at DFCon. So could we get another round of applause for our wonderful patients who shared their stories? Thank you all for being here.